Rick Bright, who filed a whistleblower complaint after being removed from his position as head of the agency in charge of pandemic response, testified for just under 4 hours Thursday before the House Committee on Energy and Commerce's Health Subcommittee. Bright slammed the Trump administration's coronavirus response and urged lawmakers to listen to the voices of scientists to prevent unprecedented illness and fatalities. Here are a few key points Bright made in his testimony. Bright said there is still no master, coordinated plan and noted that a comprehensive strategy was needed to combat the coronavirus pandemic that included widespread testing, tracing and ongoing efforts to develop a cure, as well as what to do with a vaccine once one is developed. A constant refrain from Bright throughout his hearing was highlighting what he considered a lack of coordinated strategy from the White House, including when Bright said he was quite alarmed over a shortage of swabs needed for testing. And I was even more surprised that the Strategic National Stockpile did not plan or have any of those in supply, Bright said, echoing his opening statement, where he said, without better planning, 2020 could be the darkest winter in modern history. Bright, who was removed as head of the Biomedical Advanced Research and Development Authority (BARDA) last month, also warned of a failure to plan around the release of an eventual vaccine. When asked by Democratic Representative Frank Pallone of New Jersey if Bright thought the supply issues the U.S. has seen with testing and the drug remdesivir could also happen with vaccines, Bright answered, "Absolutely, sir." Bright said he began to get alerts that the supply chain for masks and other personal protective equipment was diminishing rapidly back in January. But when he forwarded the alerts to leadership in the U.S. Department of Health and Human Services, as well as with national infrastructure and stockpile teams, he said they were ignored. Bright said that he would never forget an email from Mike Bowen, the hearing's other witness and the vice president of the medical supply company Prestige Ameritech, indicating that the U.S. supply of the N95, the respirator masks used by healthcare professionals, was at a perilous level. He said, "We're in deep shit," testified Bright. "The world is." Bright said he pushed that warning to the highest levels he could at Health and Human Services but received no response. "I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those," he said in his testimony, adding, "a number of excuses, but never any action." Bright said that in a meeting on February 7, Health and Human Services leadership said they did not believe there would be a shortage of N95 masks. "My response was, I cannot believe you can sit and say that with a straight face. It was absurd," he said.